Okay, I am ready for part two of borderline personality disorder. Um, I'll just pick up where I left off. Um, Causes, and this is from the Mayo Clinic. So Mayo Clinic is pretty good. So causes. As with other mental health conditions, the causes of borderline personality disorder aren't fully known. In addition to environmental factors such as history of child abuse or neglect, borderline personality disorder may be linked to genetics. Some studies of twins and families suggest that personality disorders may be inherited or strongly related to other mental health conditions among family members. Um, Changes in the brain. Some research has shown that changes in certain areas of the brain affect emotions, impulsiveness, and aggression. And that makes me wonder because I mentioned that I did not have a lot of this stuff as a child until I was abused and until I actually fell on my head and got a concussion. And but I don't know if that had anything to do with it. I'm just speculating. And risk factors. Factors related to personality development that can raise the risk of getting borderline personality disorder include hereditary predisposition. You may have, sorry, you may be at a higher risk if a blood relative, your mother, father, brother, or sister, has the same or like condition. Stressful childhood. Many people with the condition report being SA or physically abused or neglected during childhood. Some people have lost or were separated from a parent or close caregiver when they were young or had parents or caregivers with substance misuse or other mental health issues. Others may have been exposed to hostile conflict and unstable family relationships. Um, again, I was SA and actually physically abused by my sister um, all through my teens from when I was young. Neglect from my mother. My father, no, he was great. He was a fantastic father. I would do anything to have him back. But unfortunately, he passed away a couple years ago. Um, I know that my mother was an alcoholic for part of my teenage years. She quit on her own. I know that she smoked marijuana, um, but I don't think that would affect you, but it could. I'm not sure. Um, Hostile conflict and unstable family relationships. That would be between my sister and I. We were only 2.5 years apart. And she caused a lot of uh, hostile environment for me, a lot of physical abuse, a lot of abuse. And of course, she would deny it. I watched her physically take advantage of a 3-year-old boy, and I have to leave it at that. Um, I don't want to do all this work and have YouTube not allow it. So, okay, just so you know, I didn't read any of this ahead of time, so when I stumble, I apologize. Um, I'm learning this right along with you, so welcome aboard. So, okay, complications. Borderline personality disorder can damage many areas of your life. It can negatively affect close relationships, jobs, school, social activities, and how you see yourself, which is totally true. Um, it just makes you insecure. It just makes you, yeah. Here, and it tells you here, this can result in repeated job changes or losses, not finishing an education, multiple legal issues such as jail time, conflict-filled relationships, marital stress or divorce, injuring yourself, such as cutting or burning or frequent stays in the hospital, abusive relationships, unplanned pregnancies, sexually transmitted infections, motor vehicle accidents, and physical fights due to impulsive and risky behavior, attempted suicide, or death due to suicide. Um, I can say that most of these I can relate to, unfortunately, um, because you just feel like you're worthless. You have no purpose. Um, I guess you can get out of it, what it says. And, I gave a baby up when I was 15. Um, I've had numerous divorces. I've been to jail because of the marital conflicts. And that was 2 marriages that I've ended up in jail because of marital conflicts. Um, Not finishing an education. I got to the 11th grade. Part of that had to do with because of my pregnancy, um, when I was a sophomore. So I fell behind. And yeah, many job losses. I can't say that I really lost them because of that. I probably lost them because of the ADD and the ADHD, but that's beside. And just when I see abusive relationships, my first husband was very abusive, and so much so that I ended up getting him put in jail, and it was over his birthday. And then he went to anger management classes, and he didn't hit me at all after that. It actually stopped him. Unfortunately, or maybe fortunately, I'm not sure. Um, I found out I was pregnant, and like within 3 days, we found out he had leukemia. So I was 3.5 months pregnant when he passed away, and I was grateful or relieved. I'll say relieved, otherwise, it sounds really bad. Because then I felt like he couldn't hurt us. He wasn't here to hurt us. Unfortunately, I lost my 8-year-old son, which was the son I was pregnant with, and I felt that was unfair because that meant he was with him and I wasn't anymore with my son. So that's falls under trauma and PTSD, and we may talk about that in the future, but right now we are focusing on this. So it says, also you may have other mental conditions such as depression, alcohol, or other suicide. I told you I didn't pre-read this, I'm sorry. Depression, alcohol, or other substance misuse, anxiety disorders, eating disorders, bipolar disorder, post-traumatic stress disorder, PTSD, attention deficit hyperactivity disorder, ADHD, other personality disorders, which I was almost going to say makes me laugh because I have those, except the eating disorder and the alcohol and substance. Otherwise, yeah, check them off. I guess I'm learning something here. Maybe these videos are helping me, and I hope that they help other people in the future. And here is the references that if you have, if you need help. No, that was on a different one. Next is diagnosis and treatment. We can go through that one because it's only 9 minutes in. So diagnosis: personality disorders, including borderline personality disorder, are diagnosed based on a detailed interview with your doctor or a mental health professional, mental health evaluation that may include completing a series of questions, medical history and exam, discussion of your symptoms. A diagnosis of borderline personality disorder usually is made in adults, not in children or teenagers. That's because what may appear to be symptoms of borderline personality disorder in children or teenagers may go away as they get older and mature. I wish. Mine only got worse. I was only diagnosed in my 40s, late 40s, mid 40s. So maybe they just didn't know. I feel like it's a fairly new condition, or they just didn't know what the hell they were doing. Okay, so we have treatment. Borderline personality disorder is mainly treated using psychotherapy, which also is known as talk therapy. That's just to make it look pretty. But medicine may be added. Your doctor also may recommend that you stay in the hospital if your safety is at risk. Treatment that can help you learn skills to manage and cope with your condition. You also should be treated for any other mental health conditions that often occur along with borderline personality disorder, such as depression or substance misuse. With treatment, you can feel better about yourself and have a stabler, more fulfilling life.
Charge your phone.
Oh, shit. Hang on a sec. I'm sorry about that. I have a little, uh, oh, a little reminder on my phone, and all of a sudden it yelled at me, and it yelled, "Charge your phone." And I didn't realize that it was that low. So, okay, we'll continue. Talk therapy. Talk therapy is a basic treatment approach for borderline personality disorder. Your mental health professional may adjust the type of therapy to best meet your needs. Talk therapy seeks to help you focus on your ability to function, learn to manage emotions that feel uncomfortable, reduce your impulsiveness by helping you note feelings rather than act on them, work on making relationships better by being aware of your feelings and those of others, learn about borderline personality disorder. They put that last. Maybe they should put that closer to the top so you know what the hell you're doing. Sorry. I have a little bit of sarcasm in me. It just is in me. So anyway, management of borderline personality disorder mainly focuses on making sense of moments that are emotionally hard by thinking about what happened in your relationships that led to those moments. Good mental health management tends to include a combination of individual therapy, group therapy, family education, and medicines for related conditions. Now, I don't do good with group therapy. I hate group therapy. It sucks. I don't want to hear about other people's problems. But yet, here you are listening to me. But whatever, you can make your own videos, and I'll watch them. Just kidding. So, and then family education. My former husband tried that with the bipolar because I wasn't allowed near anybody he knew because he was so ashamed and so embarrassed that I was bipolar. So you have to convince your family members to maybe read up and get some knowledge about what borderline personality disorder is. Otherwise, you're just, they label you. And the last thing, the thing that I hate most is labels. You're this, you're that, you're whatever. Don't label me. I am who I am, and take me as I am, or turn around and fuck. walk the other way. So, okay, so we have group therapy and that. Types of talk therapy that have been found to be effective include dialectical, behavior therapy, DBT. Includes group and individual therapy designed to treat borderline personality disorder. DBT uses a skills based approach to teach you how to manage your emotions, handle distress, and understand relationships better. Cognitive behavioral therapy, CBT, it should be CBD, I'm just kidding, helps you change your your beliefs that come from disordered ways of seeing things. It also can help with relationship issues. The goal is to learn to pinpoint negative thoughts and cope with those thoughts. This treatment can reduce mood swings and make you less anxious. It also can make it less likely that you'll harm yourself or attempt suicide. I don't even know how to say that. Shima focused therapy focuses on changing negative thought patterns. I've tried to do that where, well, I would be, if you give something to somebody, have no expectations. If you give somebody $20, don't expect it back. Don't expect anything. Just don't have expectations. It sounds easy, but it's not, because it's like, hey, I gave you $20. Why can't you give me that? Whatever. But I've tried to get beyond that of expectations. So, mentalization based therapy, MBT, helps you note your thoughts and feelings and see things differently. MBT stresses thinking before reacting. Symptoms training for emotional predictability and problem solving. STEPPS is a 20-week treatment program where you work in groups that include your family members, caregivers, friends, or significant others. STEPS is used in addition to other types of talk therapy. Pass. I am not airing my shit out in front of my family members, my friends. That's stuff that I work with my therapist, with my psychiatrist, maybe my significant other, which it does say on here. That's fine, but you have to have a good relationship or label. Transference focused psychotherapy, TFP, also called psychodynamic psychotherapy. Ooh, TFP. Some of this shit just makes me laugh, because it's like, do you think you expect us to understand this stuff, but yet you don't make it to where we can understand it. That's why we don't. So that aims to help you learn about your emotions and issues relating to others by creating a relationship between you and your therapist. You then apply what you learn in other situations. Told you some of this shit don't make sense. Okay, next is medicines and hospitalizations. They're both great. Medicines. The Food and Drug Administration hasn't approved any drugs specifically to treat borderline personality disorder, but some medicines may help with symptoms, and some medicines can help with conditions that occur with borderline personality disorder, such as depression, impulsiveness, aggression, or anxiety. Medicines used to treat those conditions may include antidepressants, antipsychotics, or mood stabilizing drugs. talk to your doctor or mental health professional about the benefits and side effects of medicines. You know, to me, I have been on so many medications that I just feel like it's smack a band-aid on it, smack a band-aid, let's just put a band-aid on it. Everything feels like a band-aid, and I hate that. But yet my last uh, psychiatrist was really good. She would, if something didn't work, she would try something else, and she would keep trying until we found something that worked. So yeah, I'll give her props for that. So you have to find a doctor you can trust. That's the big deal. The other deal, I gotta straighten myself out because my back hurts. The other thing I found out, I always went for female therapists, female, counselors. But as I got older, I found that having males as therapists and counselors are better for females. This is just my personal experience, because you get a male perspective. With females, you end up talking about Barbies, Kens, and Cabbage Patch dolls. No, you end up talking about other things than what you're supposed to be talking about, and that's therapy, and that's helping. I got some weird shit from one, but I ended up going with a male this time. In essence, he sits there and shuts up unless he has to talk. He's smart. But anyway, okay, we're going to move on to hospitalization because we're at 21 minutes. Hospitalization. At times, you may need to be treated in a psychiatric hospital or clinic. Staying in the hospital also may keep you safe from harming yourself or help you talk about thoughts or behaviors related to suicide. I've been hospitalized, and the one made you do group. Again, group therapy. I don't do it. I hate it. Not for me. So, shit. Whoops. My phone decided to take a digger. So anyway, we did the hospitalization, and again, as I said, they would do like these little projects. Let's build this little, gingerbread house. You're in kindergarten again. Fuck that. So it says then the next one is recovery takes time. Learning to manage your emotions, thoughts, and behaviors takes time. Most people improve greatly, but some people always struggle with some symptoms of borderline personality disorder. You may have times when your symptoms are better or worse, but treatment can make it easier to function and help you feel better about yourself. You have the best chance for success when you work with a mental health professional who has experience treating borderline personality disorder. I always told my psychiatrist that I'm never going to be better. I'm going to be... I asked her if I was going to be on medication the rest of my life, and she said yes, and I cried. So I'm going to wrap this one up because the next one is coping and support, and it looks like it's quite long. So I'm going to make that part 3. And then I think that is going to be it for the Mayo Clinic part of it, because we're at 24 minutes right now. So I will be back. Thanks. Okay, I'm back. You don't know how many times my phone took a digger, just because the holder I have it and the charger under it. Yeah, whatever. I fixed it. Okay, so now we're at coping and support. Symptoms related to borderline personality disorder can be stressful and challenging for you and those around you. You may be aware that your emotions, thoughts, and behaviors are harmful to yourself, but you may feel that you don't know how to manage them. In addition to getting professional treatment, you can help manage and cope with your conditions if you learn about the conditions so that you understand its causes and treatments, which is really hard when you have multiple issues and not multiple personalities. Sometimes I think so. Multiple conditions. Um, know what may make you angry or impulsive. Um, Seek professional help and stick to your treatment plan. Attend all therapy sessions and take medicines as directed. Work with your mental health professional to create a plan for what to do the next time a crisis occurs. Stay away from drugs and alcohol. They just took all the fun out of it. No, I'm just kidding. Consider involving people close to you in your treatment to help them understand and support you. Manage strong emotions by practicing coping skills. Oh, my last therapist, he was a psychologist. He hated hearing coping skills. So now when I hear it, yeah. Oh, I forgot to start this over. I'm sorry. Manage strong emotions by practicing coping skills such as the use of breathing techniques and mindful meditation. Set limits for yourself and others by learning how to express emotions in a manner that doesn't push others away or make you feel abandoned or unstable. Don't assume what people are feeling or thinking about you. That's hard. Reach out to others with borderline personality disorder to share your experiences and what you've learned. What, put an ad on Craigslist? Okay. Build a support system of people who can understand and respect you. Keep up a healthy lifestyle, such as eating a healthy diet, being physically active, and taking part in social activities. Don't blame yourself for the condition, but take responsibility for treating it. So, I am going to stop it here and start another one. I think it's number 4, because this one is at almost 30 minutes, and I paused it before instead of stopped it. So I'm going to do that, and I will be back with, I believe, part 4. So hold tight.